The gaps in health services for veterans across the United States has made national headlines, and some would say here at home it's even more challenging.
Being in Guam, a territory, and far away from the 48 contiguous states, those gaps are even wider just because of our geography and our distance from the high population centers.
However, a memorandum of understanding between the Department of Public Health and the Veterans Affairs Pacific Islands healthcare system may help bridge those very gaps in healthcare for our veterans. Governor Eddie Calvo signed the MOU Tuesday afternoon.
I want to thank everyone here for their cooperation, working collaboratively towards improving the quality of services for our veterans. And again, this is very monumental.
The only primary care veterans currently receive is at the Agana Heights community-based outpatient clinic. The Veterans Clinic is considered too small and at times cannot accommodate all the VA patients on island. The Guam VA Clinic nurse manager, Bernadette Santos.
The purpose of this project is to open up access to care to veterans who live in more rural areas. As you know, whoever lives in the central area is already covered. The C block is in Agana Heights. So for them to be able to access care up in the northern area and in the southern is going to be great. We will have VA employees who will be providing this primary care. And not only primary care, actually mental health services as well. We are looking at getting a psychiatrist on board. So we will have a medical doctor for primary care, supported by a registered nurse, and a medical support assistant, and also a psychiatrist.
A security guard will also be part of the team. Under the agreement, Public Health will let the PIHCS use 2 of its examining rooms and a bathroom at both the Northern and Southern Health Community Centers for 4 days each week free of charge to render medical care to veterans. PIHCS will in return furnish a rural health extension care team to provide primary and mental health care services to veterans at no cost to the PIHCS. Public Health Director James Gillen.
We owe these veterans a debt that sometimes our Veterans Administration forgets about, and we're going to do it somehow for our community health center.
This effort is funded through federal money estimated around $500,000. The Rural Health Extension Care Team expects modest numbers at first, around 30 within the first quarter. However, that number could climb as a recent Uniform Data System report shows that at least 70 veterans are currently being serviced by Public Health. Most of the team has already been hired, with operations set to start at the end of April. Reporting for Guam's News Network, I'm Ken Quintaniza.
A psychiatrist is